Pegasus, UVA Health's medical transport aircraft that helps patients who are critically ill. WUVA went to the aircraft's base to learn more about the helicopter and how it is crucial for the health and safety of Charlottesville.
My name's Cassis. I'm the Critical Care Operations Supervisor. I'm one of the paramedics here at the UVA Pegasus program.
What is the purpose of Pegasus?
Well, the purpose is just to get the critically ill and injured back to UVA. There are certain patients, whether they're in a small outlying hospital or just somewhere with an ambulance out in the field, where time matters. And we want to keep those patients out of the hospital for as short a time period as possible. So there are areas where an hour-long drive can mean a 15-minute flight. So we can save significant time, get them to the operating room where they need to be faster. We also have the capability on the helicopter to provide a lot of hospital-type services to the patients before they even get here. Ventilators, some medications that aren't readily available. We carry blood products, so we can sometimes get things started before we're even back at the hospital to improve outcomes for patients.
What does a medical flight, what is like the protocol?
Well, it's going to depend on what the flight is. We have, you could call it a whole book of protocols, just depending on whether the person's having a heart attack, a stroke, whether they've been injured in some sort of auto accident. But what happens on every flight is there's a paramedic and a nurse on the helicopter. The pilot gets us there. We'll rapidly assess or take report from the people who are already providing care, decide what interventions absolutely need to happen immediately, take care of those, and then try to get them in the helicopter as quick as feasible.
How often would you say do you take flight?
Once or twice a day. Just sort of depends on the day. Some days are very busy, some days are slow. There are days where weather prevents us from taking some flights. Always a safety first. So one of the first things that happens when a flight request comes in is the pilot checks that individual weather at that time to make sure everything is 100% safe for us to go.
How many people are on board during the flight?
At least a paramedic, a nurse, and the pilot at all times. Sometimes we might have someone else from the hospital with us, an extra nurse, someone in training, so sometimes there's a fourth person. You'll see this is our new helicopter, which has a lot more, makes the seating arrangements a lot easier, so we're able to carry 4 and 5 just because of greater fuel.
Who came up with the name? How did that come about?
So the name was picked by hospital employees when they were developing the helicopter program. They had a contest where you could enter names, and then they looked at all the entries, and based on the ones that they had, they just decided they liked Pegasus the best. So that was submitted by a hospital employee when they were starting the program 30-some years ago.
UVA Health upgraded Pegasus, so now it has more room for crew members, equipment, and extra vent circuits. It can serve patients up to a 120 nautical mile radius of Charlottesville. The new aircraft is worth $14 million with the new upgrade.
Could you explain to us or just tell us about the upgrade you guys just had on it recently?
A 145 model helicopter is the name. It allows us to carry a larger stretcher. It allows us to carry more fuel and more crew members, and just gives us a little more space to work. In addition to that, the old helicopter, which was amazing, was nearing the end of its normal lifespan. So this helicopter provides us, just like with a new car, much newer avionics, much newer navigation system, and some added features that just older helicopters didn't have.
Since the update, Pegasus is able to travel further and reach more patients surrounding the Charlottesville area. I'm Charlotte Burgess, WUVA.